Hello everybody, welcome, Stephen Boylan back here again. So in this section what I want to do is go through some of the things that CBT is effective for treating. So CBT primarily is effective for treating anxiety and depression disorders. However, within my practice, I use CB for treating many different things as well. I use CB for treating anger management. I use CBT for treating and working with couples. Use CBT for treating stress. I use CBT interventions for treating bereavement. So I use it for a vast amount of problems that people come to counselling for. Like I said, the anxiety disorders that CBT is really effective for treating is, obviously our people come with OCD, it's obsessive compulsive disorder. CBT is one of the most effective treatments for obsessive compulsive disorder. It's effective for treating social anxiety. It's also effective for treating specific anxieties like spider phobias, needles, vomit, different things like that as well. It's very effective for treating what we call generalized anxiety, and generalized anxiety is where people are worried about lots and lots of different things. What if this? What if that? So that's a specific disorder that CBT is really effective for treating as well. And also what we call elf anxiety as well is really effective for treating. So there's just a number of anxiety disorders that it's really good for treating and that I've used CBT to treat with over the past 4 years or so within my own practice as well, and I've seen really good results by using cognitive behavioural therapy with them disorders. Also, for the depressive disorders that CBT is really good for treating and effective. It's very effective for treating what we call major depressive disorder. It's also very good for treating seasonal affective disorder, which is another type of depression where people get affected in different times of the year, for example, winter and stuff like that. People generally get the depressive disorder then. And also for bipolar, that's another more going on the lines of bipolar is a personality / depressive disorder as well. So it can be really effective for treating that as well. It's also very effective for treating eating disorders like anorexia, nausea, and also bulimia and stuff like that as well. So it's very effective for treating a range of things. What you'll notice with a lot of my treatment, with a lot of my courses, what I put together, CBT tends to be the overarching model that I use within all of my trainings and different things. I do use lots of other different things because I am integrated, so I do tend to use creative play therapy. I do tend to use person-centered approaches to some degree. Obviously, the core elements of person-centered are fundamental to any talking therapy or any therapeutic approach as well. So I tend to use a mixture of all of them different things, but CBT tends to be the overarching model that I use within all of my treatments for all kinds of problems what people come with. Most problems what people come to counselling will all be related to some kind of trauma. So whether that be the loss of a job, the loss of a relationship, whether it be the loss of a loved one, whether it be abuse, whether it be road crash. It could be lots and lots of different things that people come to CBT with, but all of them are all related to sort of trauma. So the aim of obviously CBT is help people to process what we call emotionally process them traumas that they have experienced. So trauma is a big one that CBT works with as well. So that's pretty much an handful or a number of different things that CBT is very effective for treating. So I just wanted to share that with you so you get an idea of what it can be effective. the different interventions, there's specific interventions for treating specific problems. So not every intervention is good for treating all disorders. So for example, generalized anxiety, you wouldn't use what we call cognitive restructuring, because cognitive restructuring wouldn't work for somebody with generalized anxiety. So we would use more of instead of avoiding them cognitions, we would try and face more of the cognitions rather than avoiding them. So rather than trying to challenge them as well. So the specific interventions will work for specific disorders, where they won't work for some other disorders as well. Obviously, more about that when we go into the actual course will be revealed as well. But for now, that's pretty much an overview of the different disorders that CBT can treat as well. What I'm going to do, and what you'll get from these live trainings, what I'm doing is I'm going to put also little PowerPoints underneath these videos, what you can actually download and read through at your own leisure as well. In the next level of membership, when that becomes available, you'll be able to get the worksheet, the PDF download. I think I've mentioned this before, but I'll mention it again, and you'll be able to then go and use them on yourself during the course, and then also, if you choose to do so, you can use them with your clients at a later date as well. So, like I say, anyway, that is pretty much it for this segment of the CBT training. So I hope you found that interesting, and I hope you will join me for the next instalment, and where I'm going to share with you a specific intervention which is called problem solving. I will hopefully get that done at some time today, and then you will be able to watch it at your leisure during via the portal. So again, please do share stuff in the forum, add comments to these posts, what I'm posting on, and hopefully we'll build up a bit more of people on the network in the next and coming weeks and months and years even. And like I say, when the course comes available, you'll be fully made aware of that and the costs and everything involved in that as well. But like I said, everything is always accessible and affordable for everybody. So again, thank you for joining me in this live cast around the treatments used with depression and anxiety, which is cognitive behavioural therapy. And like I say, it's also good for lots of other things as well. So thank you for attending, and look forward to seeing you in the next video. Thank you and goodbye.